allow me to introduce our next speaker. And we have Dr., sometimes he's named James Shafer, and other times I hear him named Stuart Shafer. He only does Stuart Shafer when he's coming to a Stuart program, though. So we want to welcome Dr. Shafer.
I was told to grab this one. Good evening, everybody. How was dinner? Yeah, it was very good, wasn't it? Well, it's hard to follow Dr. Steingo. And Dr. Steingo and I go back probably over 10 years. We've been doing this for a while, and he does a great job. And if he's your neurologist for your MS, you've got one of the best in the country. He's very good. So it's good to see you, Dr. Steingo. My name is Dr. Shafer, Stuart Shafer. Is there another Stuart here tonight? Where is he? He's running somewhere. But I come from Vero Beach. I'm the medical director of the MS Center at Vero Beach. And I'm going to take a few minutes tonight and talk to you about something that's near and dear to all MS patients, bladder issues. Does anybody here have bladder issues with their MS? Raise your hand. Okay, about a third of you. So it's common. So bladder cath options we're going to speak about for about 10 minutes here. So if it's something we're going to talk to you about, it'll give you freedom to live life fully. So let me get my clicker here. Hope I do this right. I did. So neurogenic bladder dysfunction, it occurs in about 80 to 90% of MS patients. At some point in time, as Dr. Steingo mentioned earlier, I think someone talked earlier about their bladder, patients with MS have neurogenic bladder. It means any kind of dysfunction with bladder function. So most bladder symptoms are managed with medication. Many of you are on meds for your bladder, and they're commonly very, very effective. But many patients require the use of a catheter to maintain bladder control and health. So what are some conditions? And as Dr. Steingo mentioned earlier, frequency and urgency. You know, you're at the other side of the house, and you've got to urinate, and the bathroom is a long way away, right? He's shaking his head over here. So that's a problem. Hesitancy. There's nothing worse than having to go to the bathroom, and you can't go. That's hesitancy. Frequent nighttime urination, again, Dr. Steingo mentioned, it's called nocturia. This is a very disruptive part of MS. It keeps you up at night. You don't get good rest. You're up every 2 hours, every 3 hours. You got to get to the bathroom and get back, and your sleep is very what we call fragmented. And then incontinence, that's the greatest thing in life, the incontinence. First, you have to wear the diaper. You have to wear pads in your bed at night. They're expensive. They're a pain in the neck. But it's the inability to hold your urine and the inability to empty the bladder completely. Again, sort of goes with hesitancy, but another issue that comes with MS bladder conditions. So how do we manage this? As I mentioned earlier, medications one way. It's very common. There's several categories of medicine we use in MS for bladder management. It depends upon the type of bladder dysfunction you have. You commonly will go to your urologist and do urodynamic testing so we can really understand where in the system your bladder dysfunction is, and it depends upon where that system problem is as what medicine might be used. Catheterization, which I'm going to speak a little bit more about tonight, and then pads and diapers, which we use, to be out for incontinence or at nighttime due to leakage or incontinence during the nighttime when you're in bed. So what are the catheter treatment options? And not everyone has to use catheters, but it is common. There's the CISC, which is chronic intermittent self-catheterization. You self-cath. You get self-cath on a regular basis usually to manage your bladder. It depends on your bladder activity. It could be every 3 hours, could be every 5 hours. It depends what it is. But still, you're having to intermittently self-cath. If you're out socially, right, restaurant, how do I get into the bathroom to go and self-cath? Especially if you're non-ambulatory in a wheelchair. If you're walking, it's not so bad, but still, you're always having to worry about where am I going to self-cath if I have to self-cath. Chronic urethral catheterization, and that's patients who may have a chronic indwelling catheter through the urethra, so it requires a bag commonly. There's a lot of issues with that I'll talk about in a moment. And the condom caths, of course, in males, and the SPC, which is suprapubic catheterization. That's supra, above the pubic bone, catheterization into the bladder. We do it through trocar punch. That's how it's placed. Open cystostomy, where they actually make an incision in the belly and put in the catheter. And then also what's called T-spec, which is what tonight is going to focus on, is a new device in the last year and a half that's FDA approved to place a catheter for suprapubic catheterization, which has basically revolutionized the procedure to make it a very, very safe very low risk placement of the catheter. So what's the clinical impact of urethral catheters? So 64% higher infection rate, and UTIs are a big issue in MS. They create pseudo-relapses, as Dr. Steingall mentioned. They are weakness, fatigue. They're really a nuisance, and they can be very troubling medically. Increase in multi-drug resistance to E. coli. E. coli is the most common bacteria in UTIs because it's in the genital area, but it's a 400% increase in those bacteria. Injury to urethra caused by rough insertion. The urethra is a very, very fine lined tissue, and it's very susceptible to injury. Continuously inserting catheters or changing catheters, tugging on catheters can be very, very tough on the urethral lining. And over time, you get strictures, and you have trouble with urination and other issues that come up with that. Erosion of the urethra is not uncommon in chronic indwelling catheters. If you pull on them, it's pain, traumatic, it's pain. Injury, it can cause scar tissue, as I mentioned. Small catheter sizes, sometimes. You get clotting in there, you get clogging of sediment and things. And then lastly, incidents of leaving residual urine in the bladder. A lot of times the bladder still holds urine, even with the urethral catheter in place, and that used to be a problem for infection as well. So the SPC, suprapubic versus urethral. Now, suprapubic catheterization has been something that at one point in time was a common way we catheterize the bladder. Over years, it diminished because the method for which it had been placed over the years was a very sort of, we call it our archaic procedure. They basically blindly, under anesthesia, poke through the abdomen and poke through and hope they get into the bladder. Well, it has about a 4% mortality to that procedure, and about a 30% complication rate. So it fell out of favor over the years, and we go into the urethral catheter. Let's not do that stuff. Let's move there. Well, this new procedure called T-spec allows for 100% accuracy in placing the catheter. So SBC in itself, instead of a urethral catheter, is more comfortable. It can provide regained independence for patients. There's no more catheters into the urethral area, into the groin area, into the genital area. It'll provide improved sleep cycles at night. Simple exchange, the catheter is very easy to change. It's easy to maintain hygiene. It's in a dry area. It's outside the area of the groin. You can remain sexually active, and a very important part of any patient's lives. Eliminates pads, diapers. You quickly heal it. You pull the tube out. Within hours to a day, it's healed. It's not something that has to be like surgically managed and sewn up if the bladder at the catheter wants to be removed. It improves quality of life, and that's really what it's about in a lot of our management of MS, is improving your quality of life. And lastly, it reduces the rate of urinary tract infections, which is a big issue as well. So a little anatomy, just so you can understand what I'm talking about. You have your kidneys. Dr. Steingall mentioned your kidneys. Very, very important organ, because this is what filters the entire system of your body, right? That and the liver. You have a ureter, which connects your kidney to your bladder. This is your bladder, right here. And then your urethra comes down from the bladder, and that's how you eliminate your urine. You get issues with this bladder, you get infections, whatever it may be, it goes up the ureter into your kidney. As you get kidney infections, you get ureter issues, you get bladder stones, you get urethral, and as I said before, a urethral catheter here in the urethra all the time causes scarring and other issues that can be problematic down the road. So this is a woman. She has the suprapubic catheter in place. It's a small catheter in the bladder. That's all there is. It's about this length. It looks like it's longer, but it's really not. So this is something that's tucked under the undergarment. There's no catheter into the urethra. There's no self-catheting on an intermittent basis. It's something that's clean and easy to manage, and the bladder sits right here. And this is here in the male. Small catheter right here. Again, usually it's tucked to the side. It's a small catheter. It hangs out from the side of the belly when the catheter is there. It can be plugged, and you can cath it as you want itself in a dry area. You can hook it to a small bag if you wish at night when you're sleeping. You can plug it, never know it's there, wear normal clothes, and not have a catheter hanging out going through the urethra. So who might be a candidate for suprapubic catheterization? If recurrent UTIs, someone mentioned earlier having recurrent ongoing infections, it can be an option. You have to talk to your neurologist, talk to your urologist about it. Chronic indwelling urethral catheter patients who are tired of having a constant indwelling urethral catheter may be a candidate for SPC. Those of you intermittent self-cath may be an option. Get away from that 3 to 4 or 5 times a day self-cathing. Diminishing fine motor skills. Over time, sometimes patients do lose the fine motor skills, hands. It gets more difficult. Caregiver spouse commonly does it, but it gets to be cumbersome for the caregiver and spouse as well. Those who have refractory neurogenic bladder symptoms, medications aren't working anymore. They used to work, they're not working any further. This may be an option for you as well. And those patients that may be non-ambulatory, it's a way to manage the bladder without having to be in a sitting, possibly in a wheelchair, possibly, or bedbound in some cases that have catheters and otherwise. So it's time to change the approach, not the catheter. So this has sort of been the change in the last 18 months to 2 years, is we're revolutionizing the way we place this catheter. That's what makes it very important to understand the distinction. It's a safe catheter to place. And once the catheter's in, it's a much better way to manage chronic neurogenic bladder for some patients. So a T-SPAC, as I mentioned, this is the device that allows us to insert this catheter. It has a reduction in the complications of the percutaneous punch that get away from that procedure. We're trying to eliminate that procedure, actually. Complications of open procedure, cystostomy that removes that. Reduction in procedure time. A reduction in complications in transurethral catheters, as I mentioned to you. Healthcare costs, it's much cheaper. It moves, instead of going to an operating room, you can do this as an outpatient, place this catheter, instead of going to OR. Accommodates neurogenic bladder. And patients who are large or obese patients and have neurogenic bladder, there's no issue. You can still get right into that bladder. We're not worried about missing it. So you have a person who's larger abdomen girth, you try to blindly punch through to put a catheter, and it could be a dangerous situation. MS Views and News. This site is going to be the sole site beginning in June 1 for the SPC catheter and bladder cath options, and you'll be able to go onto this site and review all the information. This will be the site, bladder cath options. You'll be able to get on and see it. So in summary, bladder function is essential for long-term kidney health, prevention of infection, personal independence, self-confidence, and quality of life. It's a high incidence in neurogenic bladder patients, and they're a major cause of disability. As you know, disabling MS, SPC is proven safer and efficient, and T-SPAC, the device I mentioned to you, provides a placement of that catheter. It's a non-invasive, it's minimally invasive and very quick to do. So I quickly wanted to review that with you. There's information in the back I have with you if anybody wants information or questions, and I thank you very, very much for your time. Thank you.
Does anybody have questions?
I've heard many times that in examinations of the bladder, E. coli shows up quite frequently. And that puzzles me because I always thought E. coli was a function of fecal material. And I wondered, if that appears in a bladder examination, does that mean you can have E. coli in a non-fecal situation, or what happens there?
Great question. E. coli are always associated with fecal issues. They are. That's that part of the body. Despite our best efforts to be super clean, E. coli is associated with feces, with human waste. It is.
So if you get an indication of E. coli in your bladder examinations, that means that somehow it is being transported from the rectum to the bladder.
Could be, or you were out in a restaurant somewhere, grab hold of something, and someone else didn't wash their hands in the bathroom, and you catheterized something, you introduce it that way. It's not always yourself. It's going to be somewhere else.
Okay, thank you.
Good point.
Anybody?
Cranberry supplements, are those good to take?
Yes, cranberry juice, cranberry supplements, tart cherry juice, all these things acidify the urine, and there is some benefit by doing this. It may reduce infection rates. It's probably more anecdotal, but yes, it could be helpful. Yes.
Can you explain? I mean, I saw in the pictures there, it looked like a shoestring was hanging out. That's the catheter?
I'm sorry, it looked like a what?
That thing that was hanging out of the man's
Yes,
stomach.
sir, that was the catheter. That's the actual
Is there
catheter.
a bag there? Or where does the urine accumulating?
Very good question. You can cap that. It's just capped, and your bladder's filling right through the day. It's filling. Let it fill. And if you can take the cap off when you wish. If there's a smaller cap, you can go ahead and put the cap in it, let it drain out, every so many hours if you like, cap it, go on, or you can hook it back to it, small bag if you'd like to your leg or something, you can do that. Stuart's going to get you.
But how much is that going to hold if you have a lot of urine? You know, to take out.
You can put as much of a bag as you like to hold
Well,
much
how
of
big
urine.
is that bag? That's what I'm trying to figure out.
Well, there's that little tube is nothing attached to it at all. Your urine's all in your bladder, and you can empty that bladder out into a urinal or into the toilet, anything you like.
Oh, I see what you mean. Okay,
You
thank
got
you.
it.
All right.
I know it's hard to conceptualize.
All right.
All right.
Anybody else?
Thank you again.
If not, we want to thank Dr. Shafer
Thanks,
for coming on down.
thanks, Stuart,
Thank
very
you.
much for having me. Thanks.
Hey, everybody, again, you know, we're doing a lot of programs all over the place. And if you know anybody in other states or other cities that have MS, please ask them to get to our website and get registered, okay? And they don't have to have MS to actually be at our website and know what's going on. If you have family and friends that you want them to know have a better idea of what's going on with your life and multiple sclerosis, and you want them to know more about it, your children, your grandchildren, your parents, whoever it might be, ask them to go to the website and get registered so they could get the information that we're providing, okay? And thank you again for coming tonight. Drive carefully.